Oh, the third trimester sucks, doesn't it? This is worth a watch and a save if you're in your third trimester and really struggling. It will explain why you're feeling so rubbish. Hi, I'm Angie and I'm at the Eco Midwife on social media, and I've been a practicing midwife for the last 10 years. So let's talk about the physical aspects first. Firstly, you approach your third trimester, and actually what starts happening is your blood becomes a lot more diluted. So hemodilution happens, you can see it on a previous video, and that's where iron deficiency anemia can really start kicking in. And you start feeling really tired, exhausted, everything becomes more challenging, more breathless. It's always worth talking to your midwife and getting your iron levels checked. So that can really place a huge impact on you in your pregnancy. Now, the other thing about hemodilution is because it's increasing your blood volume that's circulating around, it can increase your blood pressure. And a woman's blood pressure will always be higher at the end of pregnancy than what it was at the start. And that's because now that hemodilution has happened, and it's decaying to the blood loss that you are going to have during your birth. So it's really important for that to happen. But this is where often things like preeclampsia can become more apparent for some women. And then we've got to think about what the hormones progesterone and relaxin do. They shift all of our pelvic joints, all our hip joints. They can mean that pelvic girdle pain is a lot more common in women. But then we've also got to think about the sheer amount of weight that's happening. And this is our pelvic floor, it's like a hammock. And so urinary incontinence can also become more common in the third trimester for many women. And that's partly because of the amount of weight that we're going to be gaining. You know, we're gaining about 10 to 15 kilos extra. And that's all going to be putting a lot of strain on our pelvic floor. And that also means that we start moving backwards and we start changing our posture and our shape to be able to accommodate our baby. And so we end up a bit more like this, which again gives us more lower back pain than anything else. And you're gaining all this extra weight because you've got about a 3.5 to 4 kilo baby, you've got about a litre of fluid around your baby, you've got an extra 500 mils of volume circulating in your blood, and then you've got the additional fat that's laid down as well, and the additional tissues that you will gain. And that's part of the reason why I always say going to see an osteopath, a chiropractor, someone who's pregnancy trained, or a women's health physiotherapist, really important in pregnancy to be able to look after yourself. And all of this can mean that sleep becomes a lot more challenging because it's really hard to manoeuvre. You'll have a baby in your pelvis, in your hips, and in your rib cage, and then you've got all the additional weight. It's really challenging. So not only have you got all the physical aspects to contend with, but you've also got the mental and the emotional side of things. Our emotions are running wild, our hormones are up and down, left, right and centre. We're managing not being able to sleep, which can be really challenging as mums to be. Like most women can't sleep in their third trimester. It's bloody hard because of everything that happens. And then we've got so much awareness of things these days that we're constantly going over and over in our heads. What if this happens? What if that happens? Even if the risks are really small, we're constantly going over that. And we're starting to think that there's going to be a big transition as well. So mentally, our brains are preparing for becoming a parent. And so that's kicking in as well. And anxiety can be a fairly normal thing, but if it's impacting on daily life, if it's impacting what you normally would do, it's worth speaking to your midwife so that you can get treatment and help. And pregnancy anxiety affects about 1 in 10 women to the point where it's really debilitating. But most women will experience some anxiety towards the end of their pregnancy. And for anyone in their third trimester now, acknowledge that it's hard. It's fine that it's hard. There's nothing wrong with you whatsoever. It is really challenging. It's really worth asking for support wherever you need it and asking other people to help you wherever you can. You are not meant to be superwoman. Pregnancy is challenging. It has a huge amount of impact on your body, especially in the third trimester. And you will be okay. You will survive. The countdown is on now to meeting your baby.